Your wound will be the focus of the first 3 weeks. You have to be a man of leisure at this time. It is okay to engage in passive activities like going for a stroll, dining out, or answering mail and phone while seated at a desk. Welcome to Medical Made Easy. In this video, we are going to talk about Robotic Simple Prostatectomy for BPH. Robot-assisted laparoscopic simple prostatectomy advantages. How is the basic prostatectomy operation performed? The recovery. How would you feel? The incision or cut? Simple prostatectomy risks. A simple prostatectomy is usually performed in cases of extreme prostate enlargement, BPH, moderate prostate enlargement, with extenuating circumstances like a bladder stone, bladder diverticulum, or prostate-sparing cystectomy. In contrast to robotic surgery for prostate cancer, where there are numerous benefits, the robotic approach has some advantages over open surgery in this case. Less blood loss, possibly less pain, and improved vision of the urethra during the process of separating it from the prostatic adenoma are the primary benefits of the robotic technique. When a minimally invasive office method is neither appropriate nor preferred by the patient, one should consider a transurethral resection of the prostate, TURP, a more conventional treatment for moderate prostate hypertrophy. Robot-assisted laparoscopic simple prostatectomy surgery may have the following advantages: smaller incisions, less than an inch, more accurate reconstruction of the bladder and urethra, less blood loss and blood transfusion required during and after the procedure, less pain and discomfort following the procedure, shorter hospital stay, quicker recovery overall. How is the basic prostatectomy operation performed? Your surgeon will make one major incision below your belly button and above your pubic bone during open surgery. Multiple tiny incision ports are used during robotic procedures on different areas of the lower abdomen. You will be placed under general anesthesia for both open and robotic simple prostatectomy. Treatments while your physician removes the portion of your prostate that is pressing on your urinary tract and obstructing the flow of urine. Initially, your physician may place a cystoscope, a long flexible camera, into your penis to measure the size of your prostate and examine the interior of your bladder and urethra. After that, a catheter will be implanted to keep your bladder empty of urine. You may need additional drainage tubes placed into your bladder or in close proximity to the surgically resected portion of your prostate. After your simple prostatectomy procedure, during your hospital stay, you will be asked to walk and perform basic bed exercises, in addition to receiving medicine to manage your pain. The drainage tubes that were placed following surgery will be taken out before you are discharged from the hospital. You will be discharged home with a catheter since it may take some time for you to regain control over your urination. Following surgery, many men must use the catheters for almost a week. Recovery. The first 3 weeks of your post-operative rehabilitation will be broken up into 2 halves, lasting 3 to 5 weeks each. Your wound will be the focus of the first 3 weeks. You have to be a man of leisure at this time. It is okay to engage in passive activities, like going for a stroll, dining out, or answering mail and phone while seated at a desk. You are not supposed to drive, even though you may be driven in a car. This is particularly valid if you need to use painkillers. Note that you are incapable of driving. Rather, it's because your ability to react quickly in an emergency or other circumstance requiring quick movement may be impaired. The best way to describe urination at this point is unpredictable. That is to say, you can suddenly feel the need to urinate, and then suddenly urine will appear. You should therefore have a plastic urinal close by until you are comfortable controlling your urine. You can bring one from the hospital home. If using a urinal is not an option for you, using an adult diaper or disposable pad will provide adequate protection. Taking a shower is acceptable. You can be really tired and need to take a nap in the afternoon. A week's worth of antibiotics will be given to you upon discharge in order to assist and avoid infection. Lastly, little bleeding throughout the initial stages of recuperation is not unusual. Patients frequently experience sporadic episodes of blood-tinged urine, which is typical. Concern should not be expressed till clots develop and make it difficult for you to urinate. Should that occur, give your surgeon's office a call right away, even if it's the middle of the night. Lastly, due to the risk of bleeding, aspirin and Motrin should be avoided for the first 3 weeks of recuperation. The second stage of your recuperation will start 3 weeks following the date of your procedure and last roughly 1 month. You should start to gradually increase your activities during this time so that, at the conclusion of 4 weeks, you are back to a regular schedule. It's crucial to avoid constipation for the duration of the recuperation. Keep in mind that any pain medication containing opioids may induce constipation. So, if needed, take stool softeners and modify your diet. How you would feel. Generally speaking, the first 3 weeks will be exhausting and tiresome. You might get tired easily from basic work and take frequent naps. You can have a disturbed sleep-wake cycle, meaning that you might spend some of the day sleeping and some of the night awake. This is typical. It will continue until you get back to your regular routine of activities. You can feel less hungry and find some foods to be unpleasant. With time, these issues will resolve themselves. In general, you should only take narcotics for pain just before bed to aid in sleep. Motrin and less activity might be used to relieve pain during the day. The incision. If skin staples are used to close the incision, there may be some slight irritation in the area. If not, you should expect to feel a solid ridge beneath the incision. This will go away with time. Apply topical ointments only as directed by a physician. Your incision will take 6 to 18 months to fully heal. A tiny amount of clear, crimson fluid leaking and discoloring. Your dressing is not out of the ordinary. Contact your surgeon if the discoloration is larger than a silver dollar. Steri strips may be taken out a week after application if you have any. You are allowed to shower. Simple prostatectomy risks. Like other surgeries, simple prostatectomies are a routine and safe treatment. Although there are dangers, among the dangers associated with a simple prostatectomy are anesthetic side effects, blood clots, scarring, infection, erectile dysfunction, dry orgasm, no ejaculate, urinary tract infections. So that's it for today's video. If you found this video helpful or informative, do not forget to like and share with your loved ones. Also, do not forget to hit the subscribe button. See you next time, and as always, stay happy, stay healthy. Bye-bye.